CS, that is the cesarean section, particularly to help or to save her life and to save the life of the unborn fetus. Okay, so sit tight, listen as we go to the procedure proper. Yeah, the CS is defined as cesarean section, which means the obstetric surgery that is being performed in clinics or in hospitals so as to help the mother live and to help the baby live, especially when the vaginal or the normal delivery is abhorred or is difficult to undergo. Now, this surgery is just all about or deals with the removal of the unborn fetus from the mom, okay, so as to make the baby survive it, because it's very, very fatal if the baby is in there, hours during the difficulty vaginal process, okay, of childbirth. Okay, so it's a sophisticated process, because it deals with, the incision, the cut, from a layer down to another layer down to another layer down. You bring the fetus out, and then you still suture back. It's a very sophisticated process. So it requires tact and attentive moment in the surgical theater. Okay, when the baby is brought out, after your main cut in from one layer to another layer to another layer down, you pass the muzzle and you go down to the amniotic fluid, from the uterus to the amniotic fluid, amniotic cavity. You cut through to the amniotic fluid, you see amniotic fluid bursting out and all that, and you get the baby, and the baby is out. You have to do resuscitation for the baby. Okay, you resuscitate the baby by turning the head upside down. The baby has to go down, the head has to go down, then the legs up. You hold the legs this way, and then you arrest the umbilical cord. You just arrest it to prevent blood and then air from gasping into it, leading to more fatal ends on the baby. So you give the nurses, or you give any part of the surgical team, any member of the surgical team, for the resuscitation of the baby. Then clamp the cord, and then you cut, okay, for resuscitation. So you give, then you continue the woman. So now the mother has to be helped too. So you perform these CCT controlled contraction, especially when the delivery is vaginal. Okay, but this, you have gone down deep to the uterus, so you just slightly disembark, that you slightly remove the placenta now. The placenta now, you slightly remove it from the uterus, just to prevent bleeding, to prevent crackles of blood clots. You have to do it gently